All right, everybody, welcome back to the Adventure RX podcast. I'm your host, Dr. Nick Anderson, physical therapist by trade. Super excited to have on Dr. Lucas Summers. He's a newer friend of mine. He's just right up the block from my office, chiropractor by trade. He is the owner of Rocky River Chiropractor, coming up on about a year, right, Lucas, of being open, maybe a little over that, but we'll get into the business side of things. Lucas, thank you so much for your time today. I'm excited for this chat.
Yeah, no, thank you for having me. It's cool being that I met you at one of the first events I did to then be on the podcast and starting to get to know each other a little better and then doing something like this, working together. And that's, I know, what we talked about when I first met you. So it's perfect.
Yeah, man. I think there's a lot of overlap between our careers. I think there's many underserved patients in the community, especially Rocky River, a lot of active folk, and they could certainly benefit from, each of our services in a combo of services. What got you started in chiropractics originally? I know you bounced around a little bit to start, but what got you interested in the field?
Well, I knew I always wanted to help people. I had a nutrition background. I had an exercise background. I had an athletic background. I'm not a blood and guts guy, so I knew I wanted to keep it within the physical musculoskeletal realm. And I actually wanted to be, initially going into school, I was leaning towards becoming a physical therapist.
Cool.
I took a nutrition course at Miami University. That's where I did my bachelor's degree in. I had a friend of mine at that time. Well, long story short, nutrition course, the project was to shadow the occupation that you were leaning towards. A close friend of mine at that time had mentioned chiropractic. And at that time, I had never been adjusted. I was curious, though. So I actually called home to the Cleveland area. I linked up with a chiro. I came back. I shadowed him in his office. And at that time, PTs didn't have their doctorate. So that was something that was, appealing to me because you could see people off the street. There was a rehab background. We do take a PT board. So there's elements of PT that were kind of intermingled with that. But I liked the idea of business ownership and having that doctorate to see people off the street. So I leaned into that shadowing and that was it. I shadowed him. It wasn't even so much that I liked what was going on in his office per se, but it made me start reading more into chiropractic philosophy, learning a lot about it. And I actually committed to chiropractic school without even being adjusted. So that was kind of cool. My mentor that took me under his wing, he wouldn't let me go without being adjusted because I kind of would have been an oddball in the class. But yeah, that was it. I never looked back. And ironically, that friend that wanted to become a chiropractor actually became a physician's assistant. So he went medical and I went more holistic health and healing, I suppose.
Yeah, very cool. I was considering doing PA as well. And I shadowed a whole bunch of different career options. And I think that's the best thing you can do is spend a few days with a career that you might be interested in. And you'll know pretty quickly if you can do that for the rest of your life or not. And if you want to commit to the education, after spending a few days with, different careers, I knew right away that PA probably wasn't for me. Like you said, just a little too gross. Some of the gross stuff just didn't really want to do. So you've been open about a year at Rocky River Chiro. What's the vibe over there? Who's someone that would be a good fit to come see you?
So it's unique. It's a good question, right? Because I'm a chiro nerd, so I have dabbled into everything. I like learning, like a hobby for me on the side of this is just chiro continuing education, whether that be sports or pediatric and whatnot. I'm always trying to pick something up. But since we've been open about 8 months now, we have seen kind of everything. I haven't tailored to sports. I've tailored probably more towards family wellness. I mean, the way that my office is set up is just optimizing health and performance. So tap into either, but it's growing. I've had a lot more medical people in here lately. A medical doctor recently. I had a pediatrician. I saw like 3 RNs this morning. So that's kind of cool. Starting to get involved in that community. But yeah, we're seeing kind of a full range from, youth to elderly, people that compete. We have an MMA fighter I treat right now.
Nice.
And then some younger athletes in high school, wrestling, soccer, that sort of thing. But it's really well-versed right now. We're kind of getting the mix of everything. I wouldn't say we're seeing any one type, but all of those types could be seen because, again, we're focused on health and performance. And as a chiropractor, I look at that lens through the nervous system and mechanics. I try to make everything real simple. So if I pull up an x-ray, if I took those of you, identify, what may be hindering your performance or what may be having causing you that day-to-day pain or in functional activities. And then I try my best to make sense of that mechanically and create as big of a correction that we can to then lead people to just optimized lives, wellness, maintenance, that sort of thing.
Yeah, I think the wellness and maintenance, I've talked with various others on the podcast. I think that's an area that is getting more popular, as I think really it's like the millennial generation, sort of our age. We want to keep doing what we like to do for as long as we want to do it. And I think it's getting more popular. I don't know if it's quite there where it needs to be, like in mainstream culture. I think in the active population culture, we're talking the massages, the chiropractor work, the PT, dry needling, ice, heat, all that is sauna as well. I think it's getting better, but I think it's still, a huge area, especially if we're trying to maintain, at a competition level. Like you said, a few of your patients and a few of mine are still competing into their 30s, and it's awesome. I love it, but it just takes a little more TLC sometimes, as we start getting into the third and fourth decade.
Yeah, it's just getting people to connect to like the whole foundation of sort. I like that, just analyzing that aspect of it. It's like, why does this keep coming on? Why is it recurring? And then what do we have to do? Because most of the patients that come in to see you, outside of an obvious sports setting in season, that sort of thing, but just say you're seeing just a regular active body, that sort of thing, most of their day-to-day is pretty similar. So that's where the wellness part will, when it transcends, it's going to help people tremendously. And again, being younger docs is seeing that. Like, I used to tell people this all the time. In the 2 offices I first worked, they were high volume. So we saw a lot of patients, we took a lot of x-rays, and I did all of the new patient exams. And I was younger than most of those people. And I always just thought, okay, how do I not get to this point in my own life? And that is definitely leading with being proactive, not only treating it when the symptoms is 10 out of 10, or like you can't perform at all, so you have to be seen. There definitely has to be a level of attention prior to that point.
Yeah, I agree. It's, catching the ball before it gets rolling way too fast and out of control. It's staying on top of it, like you're saying. You don't have to necessarily be in pain or injured to reach out to one of us for treatment, right? And I think that's maybe moving in the right direction, hopefully, in our fields. But again, it's mainstreams. It's not quite there yet, but it's moving in the right direction.
I think the biggest shift with that, and what will lead us there quicker, is insurance hampers that so much and keeps them in a symptomatic box. And they don't want to, the emphasis on that is not paying for wellness. So once we're getting there too. I know with, how you practice, but even how I practice, and we may get into that point a little bit, but we take a few insurances, but I really try to steer that way, maintenance and wellness, away from the insurance and help people understand how it's actually set up to be used. But I got to get people removed from that because it's so symptom based. It has nothing to do with wellness or optimized performance, really, in that matter.
Yeah, I think we could talk for hours on the pros and cons of our system and in the insurance world. It's not great where it's at, and I don't want to open that can of worms, but
right.
Here's a good question for you. Why did you decide to go into private practice, open up your own spot? Because I know in the chiropractic world, it's much more common to have some business courses in school and go in and be an independent practitioner or join up with others. In the PT world, it's not as common. A lot more staff therapists in the PT world, which pros and cons of each. But what made you, lean toward wanting to open up your own gig?
Business ownership was definitely something I always thought about. I was fortunate when I graduated, I linked up with my mentor and for the first 2 years in practice. And what we talked about doing was launching me at that point into my own space.
Nice.
We worked together so well, though, and the patient volume grew. For me, in the first 8 years or so I've been in practice, I've always been in high volume. I've seen a lot of people. But the downside of seeing all that volume is you're not the owner. So I wanted to kind of be in control of that. I wanted to, if I was going to see that type of volume, to see it for myself and lead the office the way I wanted to and lead my staff the way I wanted to, because those clinics get a little crazy at time with the staffing that you have to hire, and it is exhausting. So me stepping into this role was, I knew I delivered great patient care. I have good rapport with everyone I've ever seen. Even coming back and open this office, I was away for, we'll call it 4.5 years or so. And I still have people coming back from when I saw them in 2019, which is really cool,
Nice.
looking me up and coming to find me. And I knew I had that skill set. So I just wanted to put it into my own space. And then, even with the naming of Rocky River Chiropractic, is less of being the guy or the face and just delivering good care that makes sense and really backing that provider pride, more or less. So,
I like that. I think that's a lot of the entrepreneur type people that I keep around and I'm friends with have various reasons of going into it. But a lot of the common themes that I've been hearing is, man, it was high volume, seeing too many patients a day. I wasn't able to provide as, the best care as possible, or at least the kind of care that I'd be 100% proud of doing, because it's just the system dictates or the business dictates me practicing in a certain way. And it is enlightening to be able to practice how we want to do, with, obviously we create our own rules and themes and everything, but it's certainly enlightening. On your site, you have a few different things listed, that certified chiropractic sports physician and then the ICPA Webster certified. I wasn't sure what either of those were.
yeah.
I didn't look those up because I wanted you to explain them to anyone listening, what both of those mean to a layman's person.
No, that's perfect. I am glad you asked about that because they're two totally separate things. The chiropractic CCSP, it's a specialized certification for a graduated doctor that is looking to specialize in sports medicine. So being that I always had in an athletic background myself, I'm a sport guy. I wanted that skill set because I wanted to open the door to that, to work with local teams. I initially did that to actually work with my high school team before I moved to the Virgin Islands to practice. I worked on the CCSP. I got it. I'll explain that in a second. But I did that because I wanted to just give back and help at my local high school. And I grew up in Parma. I went to Parma High. But a friend of mine, the same year that I graduated, he became the head coach. So I thought, how cool would this be? He's the head coach. I would become, the chiropractic sports med doctor on the team, to be there with those guys on Friday Night Lights and just give back. That's why I wanted to do it. And then I ended up moving to the Virgin Islands. So I wasn't able to do that. And then ironically, my high school got torn down. So Parma High doesn't exist anymore.
Jeez.
But going backtrack. So it's a specialized cert for chiros looking to be in that sports medicine field. Consists of minimally 100 additional educational hours in sport. You do have to take a national board exam for that and pass it. And then obviously you have to be CPR certified. It's the first stage of 2. There's something called the diplomate in chiropractic, which is 200 hours and a few other requirements. But I wanted to start with the CCSP and then actually start to kind of mold that into what sports I wanted to treat. Football was always on my mind because there's so much relationship between, a significant hit and the nervous system and spine. But also I played it. I know it. I like watching on TV. And then just some other things, like golf and some other exercise and activities that I played or didn't play or would want to do. So that's that for the CCSP. Webster certification, that is actually through the ICPA, which is Pediatric and Pregnancy Association in chiropractic. And the technique was created as a sacral analysis for a pregnant patient. A pregnant patient comes to a chiropractor, they may be experiencing low back pain, round ligament pain, baby positioning, maybe breech. That is when you would employ that technique typically. So I use it with most pregnant patients just to make sure that there's no sacral misalignment or, alignment that's affecting the ligaments that support the pelvis during that time, because tension tightness on one side will absolutely impact baby's ability to move, comfort for mom, those sorts of things. So, live patient prone, use the leg lengths, leg checks to determine, what's going on at that pelvic area, and then correct those misalignments, basically to create optimal positioning for the baby. They say when you learn that technique, it helps and aids in breech positioning, but it's not necessarily for breech positioning. But usually when a patient comes in looking for Webster, that may be the situation. It's really comfortable to do that. I think more comfortable than, the manual medical way of doing that. And it's really, really successful. I have some close friends that are primarily pediatric and pregnancy, and the outcomes with pregnant patients chiropractic are really, really cool, and they're fun to be a part of. And that's what that sort is. So again, totally different odds, pregnant patient, for sure. Pediatric, and the other side of that being chiropractic.
Yeah, very cool. I hadn't heard of the Webster, and that makes a lot of sense. I have a few friends that are in the pelvic floor PT realm. and they are, there's some overlap there with the Webster, I'm sure.
Oh, for sure.
That's really cool stuff. Another area you had listed is spinal decompression. So again, I'm gonna act like I don't know what it is.
Yeah.
Give me your elevator speech of who might benefit if someone's looking to refer. Like if I'm looking to refer someone to you, what kind of patient, might benefit from that adjunctive treatment, and what is it?
So how I do this typically, right? When we start a new patient exam, we do have X-ray in our office, so I lead
Okay.
with the X-ray a lot of times for that. Now, not
Okay.
always. Symptoms that would present a need for that, generally speaking, would be disc compression, disc injury, nerve-related symptoms. So radiculopathy of the neck coming down the arm, say sciatica, pain in the low back going down the leg. Those are usually because a nerve is involved and compressed or irritated in some way, or the disc itself is bulging back into the canal, creating those problems. So X-rays identify spacing, and then obviously, as you know, just the clinical presentation of the patient. Those are two reasons or the kind of path to putting someone on it. Now, decompression, how that works is almost exactly like it sounds, to be honest, right? People come in and they say, I feel compressed. Well, when you look at that on a spine, it's basically, actually, I'm going to grab something. This is the easiest way to explain it. So this is not my desk, but you have bone, disc, and bone, right? Compression would imply that there's pressure going throughout the disc, and that can happen here on the front or here on the backside of the facets. And then the yellow are the nerves. So when you press hard enough, that will bulge out into the nerve and then create the symptoms people are experiencing. Decompression basically takes that joint and lifts it. So it takes all that pressure off of the facet, opening this canal so there's more nerve room to move and floss like it's supposed to. And people have tremendous results on it. It's unique because in my first 8 years in practice, I did not have decompression tables.
Okay.
But I just recognized other clinic limitations. So my first office had a lot of PT type therapies. We had muscle stim, ultrasound, manual therapy. And then my second office did not have any of that. It had structural corrective exercises and wobble cushions. But if somebody came in that was that symptomatic, it was hard. We almost had to tell like this clinic is not cut out for some type of problems because we just didn't have enough to handle the acute patient. So knowing all of that, and then knowing what we see on X-rays often with arthritic changes, disc degeneration, problems that have been there for a long time. What I wanted to do in my own office was have an adjunct that was undeniably healthy for the spine in those conditions. And it has been an awesome, combo with the chiropractic bit to keep the spine as healthy as possible and keep those symptoms at bay. Like I have a patient right now, a 24-year-old patient came in from an injury February 6th, horrible low back pain, has been adjusted before. And this is likely a disc scenario based off how she was presenting. She didn't have an MRI yet. And we led into that with the decompression first, which she was a little nervous of, but did phenomenally on it. I mean, had the first visit and comfortably came off. I saw her again the next day, same type of thing. I just saw her walk through the office yesterday, and we're like 5 to 6 visits in, and that's starting with decompression, taking that pressure off the nerve, and then adjusting her night and day, like night and day. And I'm fairly confident that if we did an MRI right off the bat, she would have had a significant image. But she's young enough for that disc to resorb. But what we're doing is already steering her in the right direction. It's really cool.
Now, with decompression, can you do the neck? Can you do the low back? If someone, you can do all the areas of the spine.
Yeah, our particular tables, the ones that I have, they do both the neck and the low back.
Okay.
Hard to reach areas would be like that thoracic area, that mid back.
It's tough.
Yeah, that's tough. And because also when you're on the tables that we have, it does not traction your neck and low back at the same time, even if people have a neck and low back problem. It's usually spot specific. It's region specific. So how I work with the thoracic spine is it's usually determining, well, what's going on in the thoracic spine? Is it facet referral that's going down into the upper back between the shoulder blades? Or is it around T12? Obviously then I would do lumbar traction or lumbar decompression, and that's getting pretty good results with that. But it focuses primarily on the spine.
Sure. Yeah, that makes sense. I need to pop in and try some.
Yeah.
On my neck, that'd feel good.
It would feel good. It's really unique. The neck one's unique because the way you're strapped into it. And I always err on the side of caution with that. I start low. I know that if you're in a bad way, I'm not going to fix it on one visit anyway. So I always err on the side of caution. Make sure we don't put the patient into a spasm. Again, just referencing patients. I had a patient this morning who had done traction years ago, and you work up to a certain amount of pull. Hadn't been back in an office for a bit, but is having symptoms again and was looking for traction. I put her on that, and I kept it light. I told her it would be light, and that's kind of what she described. This is a little light. I didn't feel it pulling as much. But the point was because of what we saw on the x-ray, and the feel is less important. You know what I mean? It's mechanically, why are we doing this? And this is the goal and impact. And then as you get comfortable with it and don't go into spasm, that's when you can actually start to increase it a bit. But like everything, there's obviously a threshold on how much you would pull.
Yeah, I like the disc model. I have some McKenzie background training. If you that with the MDT stuff.
Yeah.
I think it's a nice it's a nice visual for patients to see. And, is it 100% accurate? I don't know. Everything's wishy-washy in healthcare, but I think it's a nice organizational model anyway, looking at the disc model and, looking at peripheralization, centralization,
Mm-hmm.
and desensitizing, the nerve roots and, central nervous system as well. So, yeah, I got to pop in and get a little traction going.
Yeah.
We'll
I'll
figure
take
that
you
out.
through the full. What I didn't realize I was doing when I was opening the office was creating a protocol per se, right?
Yeah.
The best way for me to treat you and your spine in the office, really for an adult. And you had asked about using decomp. You can use decompression for pretty much any adult, all right? We bear weight through L4, L5, L5S1, and that's just a general area, right? But in doing that, taking all that pressure off there, getting that vacuum effect into the disc, keeps it healthy, gets blood flow and nutrition in there, going through the roller and then being adjusted, lining everything up and taking stress off the nervous system. And not only does it feel good, but people just heal well. We get better quick.
Yeah, I think the mechanics behind it make sense. I use a lot of manual traction on the cervical spine in office, both as diagnostic, but also as prognostic and just seeing if what happens with symptoms. Are we centralizing or reducing? So yeah, the mechanics make a lot of sense. And like I said, I think that model, at least for patients, I think they see it and it's easy to understand. It's like, oh, of course, this works and this is why it feels good. Going with decompression and, like I mentioned, McKenzie, there's a lot of overlap between chiropractics and physical therapy, and you could say athletic trainers, OT. I think we are very well suited going forward to be almost like a frontline practitioners, if you want to call us that. I know not everyone is at the doctorate level now, but where do you see, in the healthcare system, maybe in the next 5 to 10 years, where do you see that overlap? We can just stick with physical therapists and chiropractors, because I'm friends with multiple of each, and I think there's certainly some overlap. Where do you see that trending in maybe the next 5 to 10 years?
It's so unique and it's kind of hard to answer. And the only reason I say that is a lot of what the chiropractor becomes, for example, if they're, rehab-based chiropractor, they may have went to a rehab-based chiropractor and had the good results that they had. Or they were really sport-focused into a certain sport, and then they become the chiropractor that really just wants to handle all of that. I've told you this before too when I first met you. I like patients do better with chiropractic and PT, period. When they're working together, they do better. I like the philosophical chiropractic. I adjust. That's what my bread and butter is. That's what I'm best at. I don't care plan, exercises for patients stuff. And again, not that I couldn't, but I do think that working separately but together would have better patient outcomes. Again, especially with our emphasis. I think with wellness, I could see it actually trending to be, it's unique, separate but distinct. I just was in Columbus this past weekend, and one of my best friends, my random roommate at Miami of Ohio, he ended up becoming a chiropractor. Now, so he initially started that journey as wanting to go into med school. He was an athletic trainer major, so he worked on all the sports sidelines and stuff. And he ended up becoming a chiropractor. And he'd be the first to tell you too, he does focus more on rehab, and less of the chiropractic side of it. With the way wellness is trending, with more practitioners trying to bring into wellness, I could see that maybe not totally breaking open. but I would like to see that. I do think that just rehab through PT is probably a little bit, can be more effective, whereas the chiro focus on chiro. But that's because I'm a true-hearted chiro. I like to adjust. I like to optimize function, and then I know that there's benefit, obviously, with the conjunction of the PT. It just has to happen. We need to strengthen and create a physical body change around the stressors that we see on the spine. And I think that's how people do their best. But yeah, it's kind of unique. I don't know how much that'll separate and divide.
Yeah, it'll be interesting to see. I think in the PT realm, I think the strength and conditioning in schooling, the education is pretty poor for the most part. I think most patients in traditional PT are underloaded. Not that I never underload patients, because I did for years, working in bigger clinics. I think that's definitely missed in the education and in continuing ed. There's no reason why, even if you don't sit for your CSCS, at least have the book and have the knowledge, right?
Mm-hmm.
With energy systems, with the major lifts, with the basics of programming.
Right.
And then, when I hit my limit with that, that's when I find good coaches and trainers. I'm like, hey, this is maxed out for me. Find a good coach or personal trainer and follow their programming with those goals. I think there's certainly a lot of overlap there as well. And that's a whole nother topic we can get into. But here's a question I'd like to ask. What's one idea or one claim in your field that is common that most patients might agree or disagree with, but what's one that you don't believe in or that you disagree with, whether that's on, personal experience, whether that's based on research, anecdotal evidence? Give me something spicy.
Well, yeah, an easy one that came right to my mind is once you go to a chiropractor, you got to go forever.
Okay, that's a good one. Yeah.
And if you're doing something from a health perspective that's making you feel good, why would you stop it? I think at least the way that I look at it, I do, when I take an x-ray, I call them awareness exams sometimes, because I want you aware of what we're seeing. If it's clinical and you go, this is healthy and this is unhealthy, well, unhealthy would imply that you have to do something for it. You can't just ignore it, right? And when I first got into practice and telling people they had degenerative disc disease or degenerative joint disease, I used to feel a little funny saying disease. And I don't anymore. I actually embrace that. And the reason why I embrace it is I wanted to connect with you. So yeah, you have degenerative disc disease at C5, C6. That means you have to do something about it. It's not something you can neglect. And I think a lot of times in like primary healthcare precisions or whatnot settings, people are just like, I have arthritis. I look at that so different. I think looking at arthritis is like if it was the roof of your house. Arthritis would be as if your roof was leaky and it's not able to protect the contents on the inside as valuable as they should. So when I see it, I like to emphasize the importance of it for people to keep that as well as they can. And a lot of times that's through exercise and through movement. It's not just chiropractic. Chiropractic's a nice piece to it because we can identify exactly which joint it is and keep that joint moving well. But I've also seen the joints that are really arthritic that don't move for nothing. And that's the scary part, because you don't want to be that patient. I had a guy in St. Croix who's a golfer, and he's a golfer for the U.S. Virgin Islands. He had, I think it was L5S1. I don't remember the type of surgery, but he had a surgery at 21, which is pretty early. He had been a little hesitant to go into a chiropractor, but he was at 37 at the time I met him, and he's still golfing. He still has back pain. We took that guy's x-ray, and the level of arthritic change at L5S1 because of that surgery was so significant, like he will have back pain forever. So the most important thing to do at this point, he's not going to stop golfing. It's to keep the rest of his lumbar spine moving well, moving healthfully. Yeah, once you go to a chiropractor, if you learn enough, you should go forever. But it doesn't mean every week. It doesn't mean the same type of frequency as you started with, because it does become where it's not symptom-based and more on structural health. You keep that healthy, keep it moving, you'll be playing with your grandchildren as long as you want to.
Yeah, I think that gets into the preventative area of medicine, right? Where
Mm-hmm.
I don't like to discharge patients, because once we get you symptom free, the work's not done. It's maintaining your function, maintaining minimal symptoms throughout the lifespan, and whether that's a runner or a weightlifter coming in for tune-up sessions. I offer tune-up sessions or maintenance sessions, an opportunity for patients to pop in once a month or so, and we can do a little hands-on work or review whatever we need to do. And again, just staying on top of it, going forward. Again, longevity is the name of the game. What,
One thing real quick,
yeah,
I love that you do that as a PT. I love that you do that because in our
it
setting,
should be, it should be more. Everyone should,
it should be every PT. Because again, if you're rehabilitating something, obviously this, you strengthen and improve it, carries over, and then you stop it. Especially when people stop that type of frequency and they don't see the provider anymore.
right.
Those symptoms are more likely to come back than not.
Sure. Yeah, we know
So
that.
it's
We
cool
know
that
the
you
research.
keep that connection. And that's again with Cairo. I think sometimes with PTs and Kairos, like, PTs obviously mindset to fix. I think some of the back and forth with that, the professions was, Kairos again want to see you like regularly. But I used to always say that, I wish the PTs would actually set that exact same way because the patient would benefit so much by having those tune-ups. They go back to doing a lot of the same things that they saw you the first time. So we want to make sure that one, you got your health and healing, functional and exercise-minded provider being able to guide you through bad patterns beyond, your initial active care plan. So it's really cool that you do that. I love that.
Yeah, I think it's missed in a lot of facilities, across at least across Northeast Ohio. Obviously some of my private practice friends are doing the same model where they're offering, discounted maintenance sessions going forward, which benefits the patient, benefits the business, creates some, regular sessions with different plans. But yeah, certainly, man. And it's, I think the chiropractic model benefits from that. I think a lot of patients in PT, they just want the pain gone and then they stop showing up, right? And it's fine, but then you're on this roller coaster of, especially with chronic issues. We know it's overly complicated with, various factors that go into that, and just popping in here and there, a couple sessions, it's like, okay, my pain's gone. But you can probably tell the kind of patients that they'll be calling you back in a month or two, in the next flare up because they didn't stay on top of it. What is your training looking like personally right now? Are you training for anything, any endurance, any strength stuff? Did I see something where you have your significant other was a power lifter, a bodybuilder, something like
Yeah.
that?
So
That's pretty cool.
the first clinic I worked at, Dr. Mart, he powerlifted, him and his wife, Chrissy Zart, at a federation called 100% Raw out in Bedford.
Okay.
And they do the strict curl, the squat, deadlift, and bench. It's a really cool federation, a good place, good run. But I did one time, so I started with the curl, and I actually placed pretty well at that time in my age group. And then the next one I ended up doing the curl, deadlift, and bench.
Nice.
But my wife went to one, and she saw his wife doing it, and it kind of got her curious as to I wonder how much I could bench, squat, deadlift, because my wife was active but not training for anything specific and not testing those limits. We left that meet and went to the gym afterward and started putting weight on her bench, and she just started being able to do a lot more than we both thought.
Wow.
And it was really cool because she is very strong, and at that time it was like totally unrefined. It wasn't the prettiest lifts, but man, she could pull, and I think she ended up hitting 335 on a dead. I mean, she was
Nice.
down to 132, maybe 315.
Wow.
Her bench was good. She was curling almost 100. She just was joking with me the other day because she just started squatting again. And mind you, she's had 2 kids since those meets. And she was like, I don't know if she just did a single at 275 on squat, but very comfortably so. And during our last pregnancy, she was at maybe not 38 weeks, we'll call it 36 or so, but she was squatting 225 for reps, very much
Jeez.
pregnant.
I love that. I love
Yeah,
that.
so she holds some records, and they're probably still there today because they were pretty good. But she's strong. My mentor doc used to say that, your kids are going to get their strength from their mom. And I always thought that was pretty funny. I can hold my own, but my wife is strong and her legs are super strong. So proud of
Yeah.
her.
Good, man. That's awesome. Where can people find you? Where can people follow you to learn any more about Rocky River Chiropractics?
Yeah, so we have a Facebook at Rocky River Chiro. We also have an Instagram, same handle. Our website has a way for you to connect with me if you had a question or message. I usually follow up right away. Those come to my email, so I see them. They're contact submissions. You can reach out that way, especially if you have any questions. But yeah, we're trying to get better at our socials, stay busy, stay active, reach the masses, that sort of thing. I love being a chiropractor. I love helping people. This is what I was called to do. So I try to teach and educate and just help. And those would be the easiest ways to do it. And then hopefully some, more and more events this year. Definitely doing more and more events to get
Good.
out there.
Good. Yeah, man. Bringing it to the community. I love it. Well, Lucas, thank you so much for your time today. Hopefully everyone learned a little bit, and if they need to find you, they know where you're at.
Cool, man. Thank you. I
All
appreciate
right.
it. And we're going to have to do a part two sometime.
Yes, sir. Yeah,
All
we
right.
can talk. God, I could talk for hours, but we'll set it up again for sure.
Awesome, man. Thank you. Thank you so much for having me.
Yeah, of course.
All right, buddy.